When we perform ultrasound examinations, we of course assume that the images that are produced by our ultrasound machine really represent the tissues and the anatomical structures we are examining. But there's something we have to know. There are certain conditions that can cause significant differences between our picture and the real situation in the body of our patients. These are caused by ultrasound artifacts.
Ultrasound artifacts are a common occurrence in ultrasound and can be friend or photos. When we don't recognize them, we maybe misinterpret our pictures because they produce images that do not represent existing anatomic structures. It is important to know and to distinguish them so that we don't get wrong informations out of our examination that could lead to wrong diagnosis.
Artifacts can be structures that are shown on our screen that are not present in our patient's body. Or there may be also structures missing in our ultrasound picture that are present in reality. And another possibility is that existing structures are shown in incorrect size, incorrect location, or brightness.
As I already said, artifacts can be friend or foe. They give us wrong information on the one hand, but can also be helpful tools to recognize special pathologies or distinguish them on the other hand. Let's make friends with them and use them for our benefit. We are going to tell you how to do it. To achieve this, we will introduce to you the most common basic ultrasound artifacts, which are the following: dorsal acoustic enhancement, acoustic shadowing, lateral shadowing, mirror artifacts, and reverberation artifacts. And we will also give you some examples and tips for either avoid them or use them for our benefit.
Let's start with the dorsal acoustic enhancement. This is definitely a helpful tool, for example, to differentiate cystic structures from solid ones. Dorsal acoustic enhancement occurs when the ultrasound beam encounters a less attenuating material somewhere in the examined tissue. Mostly, this less attenuating material is fluid. The ultrasound beam is weakened less when it passes a structure filled with fluid. Therefore, the echoes distal to the structure show a higher intensity than other echoes received from a similar depth, but passing through solid tissue. We find a higher echogenicity behind the structure filled with fluid. A typical example are uncomplicated cysts of any organ. To me, this looks a bit like the beam of a flashlight. In this picture, we see the real situation. The ultrasound beam is weakened in normal tissue, here on the left side and the right side of our fluid-filled structure. This structure, which is filled with fluid, shows less extinction, and the ultrasound beam is still strong in its appearance dorsal of the structure.
The time gain compensation of our ultrasound machines enhances the signal from the far field in order to get a homogeneous picture. The ultrasound beam that goes through the structure with the less attenuating material, in our case fluid, is enhanced more than the ultrasound beams passing the surrounding tissue. So the tissue behind the structure, filled with fluid, appears quite brighter than beside. Let's see on the next example.
In this picture, we can see a renal cyst. We can see this structure round, filled with fluid. The content of it is black. And the fluid is a less attenuating material. We already know that. And so behind the cyst, dorsal of the cyst, we see an enhancement over here. The ultrasound beam is enhanced, and in comparison to the surrounding structures, it is a lot brighter, like the beam of a flashlight.
So we can use this artifact to diagnose cystic lesions.
We got a video clip of a cyst too. Next picture, yes.
Okay, oh fine. You can lovely see this round black structure over here, and this acoustic enhancement posterior to it. I'll stop the clip.
Over here. Now it's really looking like a flashlight, isn't it?
You're right, it's a flashlight. In this clip, is there a cyst too?
Yes, it's a liver cyst.
Ooh, fine. It's very easy to detect.
In this case, the enhancement of the ultrasound beam is displayed even more easily because we've got the homogeneous parenchyma of the liver surrounding the structure. Remember this video clip? It contains even another ultrasound artifact to which we will refer later on.
Posterior acoustic enhancement can help us to differentiate cysts from solid lesions. It's like the beam of a flashlight behind the cystic lesion. And it's the result of the fact that our ultrasound beam passes through less attenuating material like fluid. From dorsal acoustic enhancement, we proceed to the opposite effect that can happen to our ultrasound beam, the acoustic shadowing.
In acoustic shadowing, the ultrasound beam is encountering a strongly attenuating material, and we get no signal posterior to the structure, which causes the acoustic shadowing. The reason for the weakening of the ultrasound beam is either absorption or reflection. The echoes distal of the attenuating structure are absorbed. Examples for materials that cause acoustic shadowing are calcificated materials like gallstones, renal stones, bones, but also air, for example, in the lung and colon gas. Let's see some examples now.
This picture shows us liver parenchyma on the right side of our picture, but in the center we see a black area, extinction of our ultrasound beam, the shadow behind a structure. Since the liver is hidden under the rib cage, the anatomic feature that causes our shadow over here is a rib. So we see this in the video clip. There's the liver over here, gas of the lung seen here, and in the center we see this black area, this black stripe behind this structure, and there's nicely seen the rib over here.
Beautiful example for acoustic shadowing. The next picture shows us another structure that can cause acoustic shadowing.
Over here.
Over here. What do you think this could be? You're right, this is a gallstone. It's a calcified structure, and dorsal of our gallstone, we got this black area, this acoustic shadowing. So this can be a help to define calcified structures like gallstones and differentiate them from other pathologies, for example, polyps of the gallbladder. The next example. The next example shows us the right liver lobe and some structure over here that causes acoustic shadowing again, which is, in this case, colon gas. Now we'll proceed to another artifact that can occur when we encounter cystic structures in our ultrasound picture. It's called the lateral shadowing, and it can also be a helpful tool, a criteria to properly display simple cysts.
Lateral shadowing appears at the edges of round structures and is caused by the rounded edges of two different materials, like the parenchyma of any organ and the epithel of a cyst, for example. The ultrasound beam is partly scattered and refracted, leading to energy loss and the formation of a thin acoustic shadow behind the edges of our cystic structure. Over here, we see this cystic lesion. There's an ultrasound wave, and it's refracted to this side, so there are no echoes behind, posterior to the rounded edge of the cyst over here. Let's see this in an example. In this particular case, we see this cystic lesion of the kidney. It's a renal cyst, and these two thin shadows coming from the rounded edges of this cystic structure, nicely seen. So we know it's a simple cyst of the kidney. Lateral acoustic shadowing.
The next example is a video clip we have already seen in dorsal acoustic enhancement. It is again the liver cyst. Can you stop the video, please?
I try so.
Once more.
So
I
can see it.
Then we can display the posterior acoustic enhancement. And these two thin shadows at the side of our cyst is the lateral shadowing. Mirror artifacts can be a confusing matter when not known. We find a reflection of an organ or a structure like in a mirror. What causes mirror artifacts? It is a highly reflective surface that is acting as a reflector. So structures are displayed twice, like in a mirror. A typical example is the mirror image of the liver at the diaphragm.
So in this figure we can see what happens. The ultrasound wave passes through the tissue, gets to these structures over here, the diaphragm for instance, and is reflected towards this structure. The ultrasound beam is reflected once against the diaphragm and then follows the pathway to the transducer. So we have got one signal over here and another signal from this sonic wave, which passes this way, and this way. So the machine shows us over here the mirror artifact on the other side of the diaphragm.
This is because the ultrasound beam, the reflected one, takes a longer time to go back to the transducer, and so the machine thinks that it's further away from the transducer than the original structure.
The second beam took a longer time, so the machine displays in a very far region. Over here we see diaphragm, and this structure, a liver vein, is also displayed over here. So a mirror artifact. All these structures are also seen over here. We can see these artifacts very lovely in this video clip. We see the IVC and the liver veins over here, and the mirror artifact is over here. Another IVC, and again a second liver on the other side.
And the diaphragm acting as a mirror. Our last ultrasound artifact we want to deal with is the so-called reverberation artifact. An ultrasound beam is reflected between two highly reflexive interfaces, and the ultrasound beam is running in between them like a ping-pong ball. So we get repetitive echoes of high reflexible structures. They have a great difference of impedance.
We can see this over here. There are multiple high hyperechoic echoes in this area, and over there it's more cranial to the liver. We see gas, air in the lung, so we have repeating echoes over there, and the sonic wave is reflected in this level, touching the lung surface, is reflected towards the skin of the patient, is once again reflected towards the lung, and once again to the skin of the patient, and at last it enters the transducer. So we have multiple echoes in the same distance from these two highly reflexible structures, and this reverberation echoes over here. Quite typical for gas in the bowel or in the lung. So we've got another video clip over here showing reverberations, I think.
In this case, it's a urinary bladder. And you can see these parallel stripes in the bladder, which can be mistaken for pathologies. But when you look closely, you've got the distance between the skin and the bladder wall, or let's say the fascia and the bladder wall, over here, is reverberated and shows us these parallel lines inside the bladder. This is also a typical example for reverberation artifact.